everybody. Welcome to this week's Ask an Expert. We are joined here by the brilliant Dr. Carol Gillis, and she is going to talk to us about soft injury prevention and soft tissue injury rehabilitation. And we're just like, we have so many questions that we already received on this and are excited to kind of dive into it. But before we do that, Dr. Gillis, do you mind giving us a bit of background on yourself and tell us where you are in the world and how you're doing this week?
Okay. I studied at UC Davis and then started my own practice, went back, did a surgery residency. But while I was working in my own practice, I started doing musculoskeletal ultrasound. So while I was doing the surgery residency, I was asked to start the ultrasound unit at UC Davis. So kind of did both. And then I was asked to stay on and head that up and do research. So I completed a PhD in tendon pathology, which was a great experience. It was pretty intense, but two full-time jobs, but very exciting. And it was great that I got to use the clinical cases that I was seeing to reinforce what the direction that the PhD was taking. So I spent 4 years doing that. Eventually went out on my own consulting and eventually wound up in Aiken, South Carolina. Bunch of horse friends convinced me to come here. And so I decided that would be a nice change. So I've been in Aiken for about 14 years and I see cases here, but I do a lot of online consulting as well. So kind of divide my time with that and my farm and my pack of rescue dogs and horses and etc. Cats, bird. So that's my life these days, and I'm excited to be sharing some of this information with everyone.
That sounds wonderful. Well, it sounds like you've got quite the herd of animals that are lucky enough to live with you. And as we kind of go about this topic, I think it makes the most sense to start with prevention, and then we'll kind of move on to diagnosis, and then finally we'll go on to treatment. So to kick us off, can we talk about a couple of the ways that people should be thinking about in order to prevent soft tissue injuries?
Yes, absolutely. I mean, really, really, the primary goal is to not have to go there at all. And so prevention, the single most important preventative tactic that people can adopt is a 15-minute walk warm-up before every exercise session. And that means in hand or under saddle. When I was showing jumpers as a kid, I had an old school trainer who used to make us do that, and he'd make us do that in Virginia in the freezing rain, and we were all just, come on, let's get to the good stuff. And he was keep walking. Oh my God. And then years later, I'm doing my PhD, and I find out we were doing biomechanical testing on tendons and ligaments, that 15 minutes is the magic number when tendon becomes more stretchy and less prone to tearing. And also a fellow in the lab was doing a joint biomechanics, and he was instrumenting the fetlock joint. And he found at the same time that joint fluid changes viscosity and becomes more chondroprotective or joint protective at about 15 minutes. So it's not 5, it's not 10, it's not 12, it's 15 minutes every time. It can seem like an eternity, but if you think of the alternatives, it's definitely worth doing. So it's just sort of like a meditative exercise or however you want to look at it. So that is a very, very key. It's free except for your time, which of course is valuable. But other than that, it's a great preventative. So that's one thing. Another prevention is give your horse a 4 to 5 day work week. Just like us, they don't want to work 7 days a week. It wears them out, it makes them stale, and it doesn't give them a chance to do micro repair of damage. If they have a couple of days of hard exercise and then a day of pretty easy, it can repair micro damage in tendon and ligament. And so it's a good thing mentally and it's a good thing physically. It's good for their muscles. There was an Italian study some years ago that showed that on the Friday before a weekend show jumping session, horses, they were measuring lactic acid buildup, which is a marker for muscle, not exactly damage, but muscle stress would probably be the best way to put it. So it would be normal on the Friday and elevated on the Monday after 2 days of jumping. By the following Friday, the horses would have done flat work for 5 days with maybe a little jumping thrown in. These are enthusiastic people. And the blood lactate would not have returned to normal on the Friday. So then the horses would jump again the second weekend, and it would be more elevated on the following Monday, of course. And so when you think about, 4 to 6 week show sessions and lots of jumping and lots of classes, and I think that other sports are similar. It's not just jumping, it's just making that kind of effort. You're having lactic acid buildup, which can cause muscle pain and can make horses take inaccurate steps, that sort of thing. It's a component of fatigue. So it's something to think about. We probably can't totally accommodate all of that, but just be aware that these types of physiological effects can last quite a while after a work session or multiple work sessions. And that kind of segues into avoiding fatigue. It was old school to train until you're tired, and that was for human athletes and equine athletes. We now know that that's a bad idea. And for humans, a lot of professional sports people, football players, et cetera, are instrumented, and their sweat is measured and all sorts of markers are measured. And if they start showing signs of fatigue, off they go and stop their training for that session. And we're starting to develop that kind of technology on for animals, but still largely we rely on the rider, the manager of the horse, to detect these things. The technology is coming along, but it's not really in widespread use yet or perfect yet. So it all falls on us to decide if the horse is getting tired and to break up that session. They can get tired within a training session or over time, cumulative fatigue, as I alluded to earlier with the lactic acid. So just keep in mind, we all get really keen, want it to be perfect just one more time, or get caught up in the excitement of a competition and go, let's just go. But just remember that your partner there is doing a fair amount of the work, and be respectful of their physiology. And it's a safety thing too, because a fatigued athlete is not a safe athlete. They take bad steps, they make bad judgment calls, that sort of thing. So the horse does usually participate in judgment calls. So those are just all kind of food for thought. The next point on prevention of soft tissue injuries is train up to your specific events and then detrain in between. You can make a plan at the beginning of the year and adjust it as you go, but no one can maintain peak condition indefinitely or for very long at all. And so pick your spots, train up to that desired day or weekend or series, and then give a break and allow detraining and recuperation that's fairly significant, and then train up. And you'll have much more success and a longer lasting athlete by being cognizant of that and taking time to do that. And the other, if I had my way, I would never talk about horses' feet, ever. But I'm forced to constantly talk about horses' feet because they are so important. Not only do they include tendon and ligaments and bursas and joints, heel pain is still the most common cause of lameness in horses. And shoeing plays a big role in that. Horses want to grow different feet sometimes, but we need to assess that, but not let the foot completely take control and just take the standard 1/4 inch off the bottom and stick a shoe on, because over time, tendencies to be unbalanced tend to get worse. Over time, as the horse ages and wear and tear accumulate in their career. So watching their foot balance, and this is sadly something that the horse's team needs to do. It's not really productive to leave the farrier on their own shoeing the horse. It's a hard job. They spend quite a bit of time with the horse, but they don't know the horse like you do, and what the horse does and what the horse needs to do. So being there and participating and having a conversation back and forth with the farrier is very important for your horse's health. There are some trends in farriery that are less than ideal for horses. It's, it's what we all do as human nature. We find a good thing and we take it and run with it and make it bigger and better and bigger and better until it's not bigger and better anymore. So shoeing that was specifically developed for laminitis is now being used quite a bit for equine athletes, and it wasn't intended for that use, and it's not good for the equine athletes to be shot in that manner. So all things to consider. We can talk about that more specifically if there's some interest, but those are some basic ideas for prevention of soft tissue injuries. And before we go on to diagnostics, we could certainly take some questions about that topic if you would like.
That's wonderful. That was a really, really helpful overview. And I think all of those kind of things that you mentioned are so actionable. Like they're actually people can go and start doing those type of things tomorrow. And so I think it's a really, really helpful approach. One thing that you had mentioned, or one of the main categories, was making sure to give your horse enough days off, riding them 4 to 5 days a week rather than 7 days a week. In the case of, I think a lot of people ride their horse 6 days a week. In the case that you are riding 4 to 5 days a week, is it your preference that they're giving those days off consecutively, or they're giving them off like not consecutively?
Okay, that's an excellent question. Not consecutively. A couple work days, and a day off can mean a hack out in the woods. It can mean, some quality time spent together, hand grazing. It can be just something different than work, than standard work. The 7-day work week just wears horses out. It definitely can happen and commonly happens, but horses perform better and last longer if they get that shorter work week. They're fresh and eager to learn and physically better.
Yeah, that makes sense. And for the 15-minute kind of magic number for walking before you get started with your warm up, is it 15 minutes and it gets increasingly better the longer you go, or is there like a diminishing return if you're going now 45 minutes or an hour?
It won't get better, but it won't get worse. You can certainly walk longer. That's the cutoff point. I actually have some eventer clients in Aiken who have horses who know they've been through rehab, and during rehab, it's a 20-minute walk warm up, even more painful initially. But once you buy into it, there are some horses who know the 20-minute walk warm up, and they insist on it. They kind of enforce, yep, we'll be ready to work in 20 minutes, not before. So they've upped the ante to 20, but it gives them a chance to look around the venue and kind of relax a little bit and gather themselves mentally as well as warm up physically.
I think it's so smart. I really, really like that approach. One question we got in advance was from Taylor, and she's asking, have you seen any correlation in the use of boots with preventing or with causing tendon injuries? Wow. Or preventing tendon injuries?
Okay, that's a very good question. Um, As far as preventing tendon injuries, we actually did a study at UC Davis on a treadmill using a bunch of different kinds of boots, which was extremely unpopular with boot manufacturers and kind of sank. That study never got wide publication. But what we found was it depends on your intent when you put a boot on. If you are protecting your horse from a blow, from another foot, a polo ball, a fence, some kind of object, you are preventing strike with boot, that's fine. If you think you're holding the fetlock up, that's not fine. There is no boot on the planet that can hold up a horse's fetlock. And what we found was it actually restricts the fetlock motion, so it can be harmful. So boots that go under the fetlock and then are cranked up with the idea of like sky hooks, they're not a thing. And you can actually cause problems applying a boot with that intent and in that manner. A researcher in the UK, a very prominent one, published a paper some years ago, quite a few years ago, saying that he thought that heat caused core lesions in SDF tendons. And and that a boot might make that worse. That kind of was the only study that showed that. And so everyone pays some attention to it. But I wouldn't say that overheating is considered a primary cause of tendon injuries. So having said that, applying boots judiciously, taking them off, when you're done, just to let the horse cool down. In general, horses use their distal limbs for a lot of heat transfer, hence, ice buckets and boots and cold hosing and all of that. They're very vascular, and it's a way for them to exchange heat and cool down. So keeping boots on kind of limits the effectiveness of that mechanism for the horse. But specifically causing tendon injuries, there's two issues with that. One, core lesions are what we used to see because that was all we could see on ultrasound. We could see a big black hole. But we know now that 80% of tendon and ligament injuries are not core. They're spread throughout the tissue. So the tissue doesn't have a black hole. It just looks darker overall and is usually enlarged. So called generalized rather than a core lesion. So the minority of injuries are core lesions.
Okay, and then you kind of just touched on this, but Simone was asking to ice or not to ice after workouts, and then at what level should you, assuming you say you should ice in some cases, at what level should you ice after cross country or even schooling?
Okay. I think part of that's weather dependent and how hard the horse works. The horse might work pretty hard schooling if you're having an issue and you end up being out there for a while. So probably if you're hot and you can tell your horse is also warm, that's a good day to ice. Or then there's the ice versus cold hosing controversy. The thing with ice is that within a few minutes, you have a layer of water between the ice and the horse's skin because they melt it. And so you're not icing for very long. You can certainly apply ice or a slush of ice and water. The advantage to cold hosing is you get the hydrotherapy. So it just depends if the horse, on the horse's foot tolerability for wetness and the resources available to you, maybe at that venue or in your barn. But you can use ice or cold hosing. But just remember that when you think you're icing, you're really only icing for a couple of minutes. You probably shouldn't ice per se for more than about 20 minutes total. But after a while, you get what's called reflex dilation. So what you're trying to do there is constrict the vessels with cold. That limits inflammation, it limits inflammatory products circulating. But after about 20 minutes, the vessels give up and they dilate. So you're probably, going longer than 20 minutes is not going to help you that much. You're just spending time.
That is great advice. And Krista is asking, she's saying Smart Pack has a tendon supplement. Does anything like that help prevent injury?
Is she a Smart Pack shareholder?
I don't think so.
No, in one word. I've looked at everything that has come along for many years, and we really don't have a supplement. Good general nutrition. If you go through the literature, glucosamine and hyaluronic acid probably have more effect on tendon and ligament health than any other product. Just the usual bog standard joint supplement ingredients have the most research. I've looked at vitamin C. I've looked at so many other. I gave horses at UC Davis, a group of research horses, enough vitamin C to sink a small ship, and we never could document any difference. And so, in a word, no.
Got it. Okay. And then I think that was all of our questions related to prevention. But if you have any other questions related to prevention, definitely put them in chat and we can always jump back to that topic. And so if you're ready, we can move over to diagnosis. And I guess starting with that, we should just walk through kind of what is your initial assessment of lameness or a suspected injury?
Okay. What I'm actually interested in doing is teaching you to have an initial assessment because you have to call us. So I would say before we involve the veterinarian, the person who sees that horse every day, you just want to run your hands down their legs and feet every day. Over their whole body is good. That tends to happen with brushing and grooming, but putting your actual hands on their skin will help. We can detect a couple of degrees of change in heat, especially if you're suspicious of, say, the left front and you compare it to the right front, on the dorsal part, on the cannon, down the front of the hoof, down the back, feel the tendons. You get to know your horse so well by just spending a couple of minutes doing that on forelegs and hind legs, that you can detect a very small change. And so you are the first line of defense for the horse. So any sign of pain, heat, or swelling, the classic 3 is cause for increased attention, not necessarily alarm, but really revisiting that spot. Probably if you're grooming the horse up to exercise, after exercise, see if heat has gotten more pronounced, or if you feel it's something truly suspicious, just taking the horse out and walking them and seeing what happens there. But the hallmarks of soft tissue injury are subtle intermittent lameness. And the reason is the tendons and ligaments are not particularly richly endowed with pain fibers. Tendon and ligaments' job, other than moving body through space, which is their main job, but their other job is to tell you where you are in space. Tells the horse where they are in space. They're called proprioceptive nerve endings. So they're much more richly endowed with proprioceptive nerves than they are with pain nerves. So tendon and ligament injuries are not painful till they're pretty serious. So, a little pinch on careful palpation is not the same as 3 out of 5 lame. So by the time the horse is 3 out of 5 lame, you can pretty much count on it. If it's due to a tendon or ligament, you've got a pretty significant injury. So subtle and intermittent, it's one of those things where you say, did I see something there? And you ask, someone else in the barn to look, did you see something where? No, looks okay. Now, the other thing we are finally learning as veterinarians is to really carefully evaluate horses at the walk. Classically, we've evaluated horses at the trot. That's fine, but we need to pay a lot of attention to the horse's walk pattern. It's slower. It's easier to see. It's easier for us to detect a change in pattern, and you can actually detect more subtle lameness at the walk, especially if you have the horse walk straight away, straight back, circle left, circle right. Lots of times that circle, it doesn't have to be too small. It can be 20, 30 feet, but just being on the bend, the horse has to actually bend its body on the circle. If just being on the bend puts a little extra load on the limbs, a little what we call eccentric load, and so it will load one side or the other a little bit more, and it can really point up the lameness. So doing that if you're suspicious is a great idea. The other hallmark over time, say you think maybe there's a little something there, maybe there's a little heat, we'll rest for a few days. So they get better with the rest for a few days. Then you go back to work and the signs come back. That's definitely the time to call your veterinarian. But you can arm them with the knowledge of, I first noticed this time, and the horse was doing this and this. So you already are helping your teammate, your veterinarian, to cut to the chase and find the issue that's going on. So those are very important things to watch for. Behavioral changes too. That's become quite a thing lately. Dr. Sue Dyson at Newmarket Animal Health Trust has published quite a bit on behavioral changes, and I think the horse has published on that and other journals associated with work, facial expressions. But for years we've known, if a horse is resisting exercise of any kind, walk, trot, canter, going over fences, lateral movement, if they just seem to be inordinately resisting, before that gets blamed on poor behavior, always rule out physical first. Always give the horse credit. Always say, maybe this is from pain somewhere, and we need to rule out pain before we try to train the horse out of that behavioral change. Make sure it's not a pain response, because they only have so many ways to tell us that they're in pain. And so, if they're saying that, it's good to pay attention. And they didn't sign a contract saying that only one spot was going to hurt. I tell veterinarians, I teach veterinarians how to do ultrasound, and then segue into rehab often. And I say, we're all staring at the bonfire. Now you have say, a bowed tendon. We're all staring at the bonfire. Where's the match? Is this a young horse who simply has a bowed tendon and everything else is fine? Or is this a horse that has a bowed tendon because he has a sore back and he's loading his left front until his tendon can't take it? So we need to be sure that the match and the bonfire are in the same location. If they're not in the same location, we need to find the match and address it appropriately. Otherwise, you can spend a lot of time and effort rehabbing the bonfire. And if the match is still there, the bonfire will come back. So there's a, a sobering thought, but it keeps us all, our minds busy. So think about multifocal, think about the whole horse when you're looking at them. Yes, hopefully, fortunately, if you're dealing with one spot, that's it. But looking around for the cause is always a good idea. And it can be multifocal within the same limb or some, as I mentioned earlier, in another location on the horse. So we have lots of work to do, and we have a horse who's not quite right. That would probably be a good spot to ask some questions or answer some questions.
Yeah, wonderful. That's a really helpful overview. And one thing related to diagnosis is just kind of as a I mean, horse owner, and if they have a hunch that there might be an issue, is your thought, like, give them that time off, try again, and kind of give them those couple of tries back and forth before reaching out to the vet? Or are you suggesting that, like, notify the vet, tell them you might have a hunch, and then kind of just keep them updated? Like, I guess my general inclination is always to, like, go to worst case scenario and want to alert everybody. Would that be your approach, or probably not your best recommendation?
No, I think you're on the right track there. I wouldn't spend a lot of time. I will say that a mild soft tissue injury has a bit shorter rehab and is a little less complex than a moderate one. And here's another interesting fact. Horses' tendons and ligaments are at near breaking strength or at breaking strength when the horse is in full work. They have a very low margin of safety. Another little nugget from the PhD biomechanical testing. When you are stretching a tendon to its upper physiologic range, like landing over a fence, following a cow, doing a 50-mile endurance ride, especially on uneven terrain, they're in the red zone. They have far less margin of safety than bone does. So if you tear 10% of the fibers, which is going to be hard to detect, now you're in the red zone at a lesser level of work, so you can do more damage. So if you have a hunch, if you have a strong hunch, go ahead, get your veterinary team member involved. You guys spend your lives with these horses and you know them better than anyone else. So if you think something's wrong, it may very well be wrong. So I
Yeah.
don't mislead you into wait and try a bunch of times.
Yeah.
You're talking about days here, not longer.
That's great advice, and to trust your intuition on this stuff too, because you'd rather also, assuming you don't go way too much to another extreme, you'd rather
Right.
overcheck than undercheck. Okay, well, if you have any other questions related to diagnosis, definitely put them in chat. But I'm seeing some questions come through here on treatment and rehab, so I want to make sure to leave plenty of time for that. And so I guess let's jump into that, and we can always come back. But for treatment, what kind of modalities do you find most effective, and what kind of modalities are you finding to be the least effective?
Okay. Before I start there, I just want to say this because I may say it more than one time because as a consultant, and that terrible word, I often see horses that are months out from the problem starting, and they have had a lot of treatment, and they are exactly the same degree of lameness and dysfunction that they were on day one, and now we're on day 280, and everybody's getting tired of it, including the horse. So the single most effective treatment for a soft tissue injury is controlled exercise, not a modality. It's so interesting. I helped start the sports medicine board specialty. And we had our first meeting finally last year. And Melissa King, who is a rehab person at Colorado who has some serious chops, was being asked that exact same question. And she said, controlled exercise. And I said, oh yeah, because this is something I've been saying for quite a while. And, also say when asked that, because you can, if you are on a tight budget, you can rehab a soft tissue injury with a lead rope and a watch. You can add things which can be helpful and can be useful, but if you try to do the treatments without the controlled exercise, you will not have the outcome that you want. You may have an okay outcome, but this is where the published re-injury rate for a soft tissue injury is 40%. That's a daunting figure. It amazes me that people will go into it thinking that that's the percent. In my practice, the re-injury rate is 15%, which is the same rate of injury every year for horses in active work who've never had an injury. So that's where we want to get back to when we have an injury, is the same risk level as if there had been no injury. That's our goal. The reason for 40% is most commonly the horse is put back to work without healing. And that can be on the entire team. The way to assess healing is with a good clinical exam and a good ultrasound exam. And you have to be very picky about the ultrasound exam. And as time goes on, I mean, the first exam is the most obvious. The horse has got clinical signs, and the changes on ultrasound are or not very obvious, but the most obvious they're going to be, hopefully. And then over time, you do your periodic exams every 6 to 8 weeks. The clinical exam should normalize pretty quickly if you're effectively taking care of the horse. So then you're left with the ultrasound. And so you have to be quite picky and detailed about the ultrasound exam. The last parameter on ultrasound that normalizes when they heal is the fiber pattern. And that indicates collagen that has aligned on stress lines, along stress planes. In other words, for the superficial flexor tendon, that's going to be from the forearm down toward the pastern. So that's where the stress goes, right down from up to down. And the fibers should be in parallel alignment. And that gets written off a lot. And a horse that goes back to work without parallel linear alignment of their fibers is in that 40% category. A horse that goes back to work with parallel alignment, even if it takes a few more months and patience and time and tweaking the exercise as needed, it gets into the 15% category. So time and patience are essential. And it's really misleading to you guys to say that tendon never heals. It does. You just have to ask it nicely and repeatedly and patiently, and it will heal. It will heal. It may not be perfect, but it will be in a functional strength range. And that's what you need to get to that 15% nirvana. So controlled exercise is exactly what you need to do. You can add other things, and we will discuss those as you like, but they are adjunct therapies to the controlled exercise based on regular examinations, because there's no way to tell. People say, is the horse ready to trot? Well, let's look at the ultrasound image and see. So,
Can you tell us a bit more about what that controlled exercise looks like? You had mentioned a lead rope and a watch, but what kind of things are you looking for
okay.
people to be doing with that?
Okay. And it varies with the severity of the injury and the location of the injury. Probably treat a back muscle injury, not probably. We would treat a back muscle injury differently than, say, a pastern ligament injury. Any injury that involves a joint involves the joint. So if you have collateral ligament injuries in the coffin joint, then you got to deal with the joint as well. So that life gets a little more complicated. But talking about strictly soft tissue injuries, we generally start out with hand walking. I never leave these horses in the stall. There's still a lack of knowledge in my own profession, and I really work hard to try to help with that, about how to rehab. And if people don't know, they default to how to rehab a stress fracture. The way you heal a stress fracture is, which takes about 4 months, is leave them in the stall. and it's a young horse, usually like a racehorse or a horse starting into training, and that's how you heal them. That is not how you heal a soft tissue injury. The horse needs to get out of the stall from day one. He never stays in the stall 24/7, never, unless they're hanging by one thread and ready to rupture. That is less than 1% of cases, less than 1%. So 99% of cases need to be out hand walking twice a day from day one. So there's the lead rope and the watch. So how long you walk depends on the severity of the injury and the location, but how frequently you walk is 2 times a day, not less. They need to move. They need to move for a lot of reasons. And we kind of proved this inadvertently. When I first started the ultrasound unit at Davis, a lot of the veterinarians in the area, horse vets, had patients that were off the track thoroughbreds, because we had 2 big racetracks in the Bay Area at that time. And they were concerned that those horses were not safe for their clients to hand walk. So they would take my hand walk instructions and throw them out the window and keep the horse in the stall. So I would see them at 4 to 6 months, and they would not have healed one teeny little bit. They would look like they did on day one, except they would now be developing arthritis in multiple sites, because they were usually 12 to 14 years old by then, or 11, or somewhere in there, and would have had enough time to start that. And that inactivity, that forced inactivity, would have allowed all these little arthritic sites to flower. So I was absolutely horrified by that. But it definitely showed me that that is not the way to go. Definitely not productive. So they need to move. Tendon and ligament, as I said, you have to ask them nicely. They're kind of inert tissues, but not as inert as is in the literature. They will respond, but you have to load them. They're efficient. If all the horse is doing is standing in the stall, that's what the tendon and ligament adapt to. Okay, we can hold standing in the stall. We don't need to do anything. If you take them out and you walk them in gradually increasing amounts, the tendon and ligament are constantly being signaled that they need to get stronger, add collagen, heal. So that's what you're doing when you're moving the horse around and trying to stay alive.
Got it. And how do you recommend that people who don't necessarily have direct access to you, how do you recommend that they're coming up with this rehab schedule of how long they should be out walking, and kind of what the increase in the difficulty should be, and kind of at what pace you should be increasing their activity and whatnot?
Right, right. There are veterinarians around the country and around the world who know about this. It's worth seeking someone out. I do a lot of online consulting, looking at images, pictures of the horse's feet, ultrasounds, radiographs, the history. But seek someone who has some qualifications in your area. Your attending veterinarian may very well know these plans. I have some information on my website, but it's not totally specific, because it's not appropriate. There's always some tweaking. Let's put it that way. It's too hard to be specific for each case without knowing what's going on with each case. Again, you treat that 2-year-old with a bowed tendon differently than you treat the 14-year-old jumper who also has a bad stifle.
Yeah, absolutely. So Lauren is one of our Ride IQ coaches, and she's in chat, and she's asking if you could put funds into one techno toy, laser, PEMF, light therapy, any other gizmo out there, what would be your favorite? And she said that she's asking as the gal wearing her class 3 laser wrap on her angry Achilles.
That will work well for your Achilles. That will work well for your Achilles for 2 reasons. You're relatively small and you don't have fur. It is an interesting fact that people use laser a lot on hair, over hair. Laser doesn't penetrate hair particularly well. If you go on PubMed and you look at published peer-reviewed research, it loses its effectiveness when you use it with hair. So people don't like to clip, because it's sort of like an advertisement. We have a problem here. We have a problem on this leg. However, if you're using the laser, it's probably the lesser of 2 evils to clip them. Clip a wide area. But having said that, laser is probably overall the most effective tool for soft tissue injury. Usually class 4, that's in the hands of a professional, because you can burn a hole in the wall or your eye with it. And that can be expensive and time consuming. Very shallow injuries like a bowed tendon, you can do some good with in the horse. Certainly skin wounds, skin right there. Laser class 3 is great for helping to heal skin wounds. But once you get to suspensory ligament, you're starting to struggle with depth problems with class 3 laser. Kind of maybe is helpful, but we're not sure. Might be in one horse and less than another, a bigger, heavier horse, or many factors there. But probably the most effective thing to do is bite the bullet and have 4 weeks of class 4 laser applied to your acute injury several times a week. And there are big practices. I consult for a number of them around the country who have technicians who go out and do that at barns. It's not free. But failing that, you can kind of work within that parameter. But if you had to have one thing, laser would be the thing, and probably for most equine injuries, class 4. If you're treating a dog or a person, class 3 is a good deal.
Lauren added into chat that she said, "I mean, you don't know I don't have fur," which fair.
I'm assuming you don't have fur. That's true.
Thanks for the addition, Lauren. You always have great questions. So we got a question from Anna. She's asking, how does PPID affect tendon injury prognosis?
Adversely. Yeah. I'm not a medicine person, so I just want to say that up front. I trained as a surgeon and a sports medicine person, but I have a horse with PPID, and I see it complicate my rehab programs and frustrate me frequently. So yes, there's no doubt that PPID has an adverse effect. In some horses, controlling the PPID to the extent that we can will turn that around. And I have horses with PPID who go back to their job. We just graduated one last week. He's a big, heavy Clydesdale thoroughbred cross who is a jumper. And amazingly, he's a good boy. And we struggled with him because he had a foot tendon injury, a deep flexor tendon injury in his foot, not a good spot to have injured, and PPID. And it did take his rehab longer, and we've played around with managing. I've worked with his attending veterinarian and medicine people from a nearby university to help manage his PPID to the maximum. And he's going sound and back to his job. So it can be done. It did take longer than normal, and it took some extra team member involvement to get that done. So it's always a good question. That's another good question. We're diagnosing PPID earlier and earlier in horses. So if you're doing everything right and things aren't healing well, it's time to test.
Okay. And then Lauren had a follow-up question. I don't know if she actually meant for me to ask this, but she's asking, do you mean to clip like 10-blade clip, or would just a reasonable aesthetic tightening help get access to the tissues you want to blast?
Yeah. See, what happens when I ultrasound the horse is they get a 40-blade clip, and so then people go after it with the laser. But because I want to see the tendons really well, and by that time everybody's given up, the idea that there is not an injury. We know there's an injury. So I think a 10-blade clip is a reasonable tactic. If you have feathers, you can part the hair. If you're dealing with a horse that has feathers on their limb, you can actually part the hair and aim your laser. You have to keep reparting. It's somewhat laborious, but I do have clients who do that. So it's just that medium thickness fur that's somewhat problematic.
Makes sense. And I know we have about 15 minutes left, and we've received some.
Oh, you're muted.
Can you hear me now?
Yep.
Okay. I was just saying we received some very specific questions from some members about their specific horses and like the prognosis for them. So we have kind of limited time here, but we can try to do one or two. And to the extent that you're not able to answer because you don't have enough information, that's totally reasonable. So Miranda is asking for your feedback on bringing her horse Spanky back into work after being diagnosed with primary right SI ligament desmotus. I know.
Yep. Desmotus. Yep.
With secondary bilateral proximal suspensory desmitis of the hind limbs. He's been off since October, and they've gotten the green light to start trotting on April 1st. He received PRP, shockwave, and Adequan. He was diagnosed as a 5-year-old, and the vet said the initial injury to the SI was likely a pasture accident as a foal that went untreated. She's curious about his prognosis and if he will ever get to be the inventor he was bred to be.
Okay. I wouldn't rule that out. What I would have you taken hindfoot radiographs?
It's a great question.
If you haven't, you need to, because I've endeared myself to my local veterinarians in Aiken and around the country for the last 10 years, insisting that horses have lateral foot films all the way around, because you need a positive palmar P3 in the front and a positive plantar P3 angle in behind. Neutral or negative P3, in other words, we're talking about the sole of the coffin bone relative to the ground surface, needs to be tilted upward toward the toe. If it's not, you have an increased risk of, in the hind limb in particular, hind suspensory and stifle injuries. So if your horse doesn't have positive plantar P3 angles and plenty of caudal support for his hind feet, that is something you can definitely do to help him. As far as prognosis, I wouldn't rule it out. That's a bit of a wheelbarrow load of problems, but not impossible. That SI often, when there's SI subluxation, actual subluxation, and I have a way that I measure that when I'm scanning transcutaneously, is actually through the skin, through sometimes that can be a management issue. We do try to heal the ligament as best we can. It's a spot that's hard to ultrasound because you never get at 90 degrees to the ligament, and that's essential for a good ultrasound image, to be at 90 degrees to the target tissue for at least part of your exam. So that can be tricky as far as diagnosis and as far as detecting healing. For dorsal ligaments, definitely you can follow healing, the ones that are closer to the skin surface in the back. And hind suspensories do heal. And I think that shoeing is one of the most important components for that.
Really, really helpful feedback for Miranda. Thank you. Jillian is saying that her horse is rehabbing from a right hind small core lesion in proximal suspensory ligament zone 1A-B or /B. He had an injection of Regeniflex and was put on a stall rest for 7 weeks with 3 rounds of shockwave therapy. After the 7 weeks, another ultrasound was performed, and he was able to transition to a small field turnout for approximately 6 weeks. He has his hopefully final ultrasound on the 5th of April, where they will determine a rehab routine to get back into work. Knowing every case is slightly different, what sort of schedule do you typically recommend for a horse coming back into work after such an injury?
Okay. Get your ultrasound first and see where you are. Tell me about the paddock, the turnout.
She didn't provide, she said small field.
Small field. So my patients get turnout when they're cantering under saddle, not before. So they are in controlled exercise until they don't do a gait by themselves, because horses, as we know, don't always make good life choices, just like people. And 30% of my patients injure themselves in pasture turnout, even though most of my patients are hardworking horses. They just, they just randomly do things. So when I'm rehabbing a tendon or supervising one or consulting on one, the horse does controlled exercise through hand walk, ridden walk, trot, canter. And when they've cantered for a minimum of a week, that's the first time they see a pasture or a paddock. So I hear the history that I'm hearing from you often. I would reserve judgment to see how things are healing with the ultrasound.
That makes sense.
But you definitely need, your rehab program should look like a linear graph. If you are at the bottom, lower left-hand corner, when the injury occurs, and the upper right-hand corner is where you want to be, is your goal, your target goal in your full use and work with your horse. That should be a straight line. There should be no bars in your graph. So steadily, gradually increasing exercise is absolutely the key to an optimum rehab.
The feedback or advice related to Turnout, I think, is super key there. And I think that a lot of people, I mean, even unrelated to this specific case, a lot of people can take that information back and apply that to their own horse's rehab. So,
And then,
go ahead. Sorry.
really quickly, because just to make this point, it's an important one too. I would love it if we could just turn horses out. That would save me 85,000 emails a year. But at least there was a paper published on national hunt horses. Those are British horses that are, you guys probably know this, but that's steeplechase horses. So they do a hard job. That they had straight up bowed tendons, so nothing too complicated. A bowed tendon is a piece of cake to heal. You just go through the process, seriously. But these horses were treated with Turnout, and less than 25% of them, they were turned out for 9 to 12 months. They had 90 days of stall rest and then 9 to 12 months of Turnout, and 25% of them were able to complete 1 year back at their job without a re-injury. And I say re-injury in quotes because I think they were never healed. So that's a pretty low number. If you're interested in percentages at all, that's not a very good number. So that's what you can expect from Turnout, is a low chance of going back to work without a re-injury, quote unquote, unless you've gotten incredibly lucky and your horse is in that small percent that is able to heal under those circumstances.
These studies that you're quoting are absolutely fascinating. Like, those numbers are staggering, and yet somehow, like, that's not something that everybody knows and has heard about, and it's really, really interesting.
Give up your personal life and read scrutinized literature. I'm kidding.
Yeah.
No, anyone to give up their personal life. I try not to give mine up. I fight hard. So, but this is geek material that I'm giving to you as in 4 bites instead of many.
It's super helpful, and we appreciate it. You've done all the heavy lifting for us. So, Caitlin is wondering if there are any advancements on treatment or management of DSLD.
That's a tricky one. I think that DSLD is somewhat overdiagnosed. I think horses get labeled with it who don't have it. But if the horse actually has it, if the fetlocks are actually sinking, generally the hind fetlocks, but can be the front fetlocks as well, true DSLD, and may be linked with metabolic disease, is very, very difficult to treat. You can manage it with extreme shoeing and keep the horse comfortable, but you are unlikely to make an athlete out of that horse. You're going to have a comfortable, hopefully, retirement for that horse. So it's one of the few things that I'm not optimistic about healing. Some of the gated breeds, Peruvian Pasos, Paso Fino, some of those horses get labeled with sort of a congenital or inherited DSLD, which has never been proven, despite a lot of attempts to prove that. And I have been able to help some of those horses recover so they don't have true DSLD. So you really want to be careful about making that diagnosis. But if it is made, it's a very serious diagnosis.
Got it. Okay. And then Rachel said, for a horse with a hind medial branch suspensory tear that became worse with rest and hand walking 20 minutes 2 times a day, PRP, shockwave, laser, all the best treatment. He was a fit novice training level horse at time of injury, 13 years old, with no other arthritis, but possibly with an old suspensory injury to that branch that was not known. At 7 months, he has now been gradually transitioned to full pasture turnout and able to do groundwork. What would be and this is going to be, I think, a similar response to the I'm reading this and feel like I know what you're going to say. What would be the next steps in terms of when would you do flexions or ultrasound again, or just give him time to be thankful that he's pasture sound and see what his soundness shows in 6 months to a year?
Okay, he's 13. Part of the reason I'm laughing is that medial suspensory branch injuries are a very hot topic among ultrasound geeks right now. There's been a paper published saying that they're not real. And obviously they are real sometimes. It depends. Okay. I hardly ever go to the movies, but I did see Top Gun 2. And when Tom Cruise said it's all about the pilot, I just started laughing out loud. I was, yes, almost chucked out of the theater for loudly laughing. But because that is so true. It's all about the pilot. You need an accurate ultrasound examination. And part of this controversy is caused by people of different skill levels um, obtaining images and calling different balls for the same situation. So yes, medial suspensory ligament injuries are real. They often go along with oblique sesamoidean ligament injuries. The suspensory ligament pulls up on the sesamoid bones in the obliques or in the pastern, and they pull down on the sesamoid bones. And our current thinking, geek thinking, is that you have to ultrasound both to get the full picture because the oblique sesamoidean ligament may be messing you up. As far as the treatments, you've certainly done all the things, and those are good treatments. They're valid treatments. I do see horses like this, and often they respond just to simply more time. One bad thing that suspensory ligaments do, and bow tendons will do this too, they try to bandage themselves. But again, it's just like we try to bandage them. We go round and round instead of up and down. So they don't really provide support. They actually constrict, and you can actually have scar tissue form between the two branches when you look deeply on the ultrasound from one side of the leg, the outside to the inside, or inside to the outside. Plus, you start to notice thickening between the skin surface and the suspensory branch, swelling over the branch. It's not swelling, it's tissue, it's thickened tissue. So that is a counterproductive method, and we don't really know how to address that. It's one reason to try shockwave. It's one way to try laser to try to modify that tissue, but it's pretty dense tissue. Shockwave probably has a better chance than laser of budging it. But I think that process gets set up at the initial time of injury, and it's not necessarily they're getting worse. We are not halting the progression of a process that is underway. So back to your question, I would, he's 13, time is ticking by. I would probably ultrasound him at 2-month intervals and see how you're doing and exercise accordingly based on the results, because you don't want to wait 6 months or a year go by. Things can veer seriously off the path in that amount of time, or he could be better and you could be enjoying each other's company, maybe doing a little work or more work.
Yeah, absolutely. Well, Dr. Gillis, I mean, you have shared so much knowledge over the last hour. I can't really I feel like I walked into this knowing very little or nothing, and actually feel like I'm very informed now. And I really appreciate you sharing all that knowledge with us and taking the time to answer our questions. Before we kind of wrap a bow on this, I wanted to make sure to just give you the floor in case there were any questions that I didn't ask that you think I should have, or any topics that we should have covered, or do you have a soapbox that you want to get on and say a few words? Feel free to use this time for that.
Okay. I think I never quite get off the soapbox because I'm so used to trying to help my patients by informing the people who are their team. But I think just if you want to take away something from here, remember that these injuries are subtle. Get used to palpating your horse's legs. Prevention. As far as diagnosis, take subtle intermittent signs seriously. And as far as treatment, remember that lead rope and the watch. Yes, many other treatments are very helpful. I recommend shockwave. I recommend PRP. I recommend laser. Therapeutic shoeing, definitely critical. One of the things you can't get by without. Need to address the horse's foot balance. Need to assess astutely and act accordingly. And if you have an injured horse, don't let the farrier tell you we're going to take 8 to 10 months to change this foot balance. No, that's fine if the horse is normal. If the horse is injured, the foot balance needs to change. That shoeing, you don't have 8 to 10 months unless you want to do a 16-month rehab. So you need to fix the foot balance so that you change the load on the tendon and ligament. Another tidbit is if you do make a major change and you have a horse who's already, say, trotting or in work, and you make a major shoeing change, walk the horse for a few days to let them get used to the new balance before you try not to do that in the morning, between classes at the show, because that may create a problem.
That makes sense. That's a really, really helpful summary of kind of the various topics we discussed tonight. And I mean, thank you. Just thank you so much for sharing this. Thank you so much for being such a wonderful resource in this community on a topic that is very stress inducing for a lot of people. You have really narrowed it down to a couple of really actionable and easy to follow methods for prevention, diagnosis, and treatment. So we really appreciate you, Dr. Gillis, and everyone who attended live. Thank you guys for being here and asking such wonderful questions. And we'll see you next week. Have a great evening, everyone.
Yeah, my pleasure. Great questions. Great question.